You joining us live now from our NewsNation station in New York City is Dr. Purvi Parikh. She is an allergist and immunologist with Allergy and Asthma Network. Doctor, as always, good to see you. With half of the country unvaccinated, cases rising again, as we just showed in that report, do you anticipate that we will relapse into what we saw last year?
You know, if we're not careful, we may. Cases are up 145% from what they were 2 weeks ago. And it is in mostly unvaccinated people, as we've seen, deaths and hospitalizations. So, we are seeing a surge, and there's also fears of further mutations if those people don't get vaccinated.
I'd like to talk to you for a moment about masks. I sat down with former Surgeon General Jerome Adams at the White House last fall as cases of COVID surged then. Now he is back in the headlines again, this time with a tweet about masks. And he said last year, Tony Fauci and I famously, prematurely and wrongly advised against masks. I felt it was the best call at the time, but now regret it. I'm worried the CDC also made a similarly premature, misinterpreted, yet still harmful call on masking in the face of the Delta variant. So does the CDC have this wrong? Should everyone, even the vaccinated, be masking up?
Yeah, the devil is in the details. Definitely indoors where we know the virus can spread. Yes, we should all be masking. If you don't know if the people around you are vaccinated, you should be masking. Outdoors, there is less spread. But yes, I think the initial messages did cause a lot of confusion for everyone. And the masks we know do work, especially if everybody's masks. It reduces transmission significantly.
So given the rise that we're seeing, do you think we should be masking up again, requiring it inside?
I think so, especially because it is very hard to track who is fully vaccinated and who isn't. And even if you are fully vaccinated, you can still spread the virus if you have symptoms. So once you're symptomatic, all bets are off. And it's almost impossible to know who may have mild symptoms. So Los Angeles already has reinforced mask mandates, as has Las Vegas. And we may see it in other parts of the country.
Dr. Parikh, we have learned that a vaccine for kids will likely be available midwinter for those 12 and under. That is well after the start of school. This is a big concern for a lot of parents. The AAP is advising kids mask up. What is the best way for us right now to protect our kids through the rest of the summer and as they head back in the fall?
Right. The best way is that for everyone who can get a vaccine, meaning people 12 and up, to get that vaccine, because then it will protect the children who cannot receive the vaccine as of yet. And as soon as those children are eligible, they should also be vaccinated. Outside of that, it is important for our kids to get back to school. They get immense learning advantages and benefits. So if it can be done in a safe way, that would be best. So that's why the AAP is recommending masking in school, so that way children can still attend.
Finally, the CDC and also the State Department advising against travel to the UK specifically because we're seeing a spike in COVID cases there right now. What is your advice to folks about non-essential travel right now within the U.S. or elsewhere?
Right. I would still avoid non-essential travel, especially if you're traveling to an area where vaccination rates are low or where the Delta variant cases are spiking. Much of the world, we forget, doesn't have access to the vaccine. So you have to really look at local regulations and rules and consider it very carefully with all the pros and cons and take into your own health and risk in account.
Far from out of the pandemic, Dr. Purvi Parikh, as always, thank you for your time.